Hello, my name is Mathur, and I'm a board-certified orthopedic spine surgeon. I've been working with Cary Orthopaedics now since 2009. I specialize in minimally invasive spine surgery, and today I wanted to discuss one of the most common surgeries that we do, which is a minimally invasive microdiscectomy. One of the most common reasons why we do this surgery is when you have a herniated disc. I'm going to go through an animated model to explain to you exactly what a herniated disc is, what are the components of the disc, and then what surgery that we do. When I do microdiscectomy surgery, it's usually an outpatient procedure. Patients go home the same day. I'm going to discuss one of the most common causes for leg pain, which is sciatica, resulting from a disc herniation. So when you look at the spine, what you see is multiple nerves that go down into your legs. And if there's any compression of these nerves, this can result in back pain, leg pain, numbness, tingling, and weakness in the leg. One of the most common causes for leg pain is what we call a herniated disc. So if you look at this structure, this is what the disc looks like. And the primary function of the disc is that it's a shock absorber. So the disc has two main components. One is called the nucleus, which is the jelly in the middle, and then these circular bands, which is called the annulus. And the job of these bands is to keep the jelly centered in the middle here. Over time, you can have cracks in these bands, and this results in weakening of this disc. And eventually, this jelly, which is liquid, can leak out through this crack over here and compress the nerve. As you can see on this side, that the nerve is very close to the disc, and any herniation of the disc results in direct pressure on the nerve. Once there's pressure on this nerve is unable to send signals properly into the legs, and you can experience weakness, numbness, tingling, and difficulties with your activities of daily living. I'm going to discuss the surgical technique of how we do a discectomy, which is minimally invasive. This is what the spine looks like when you're looking at it from the rear view. So these structures here I'll call the lamina, and these are the nerves that run into the legs. As you can see that this is a herniated disc, and this disc is pinching this nerve, which is in red, and causing compression on the nerve root. As you can see, this is the level where the nerve is compressed. We identify this level on X-ray prior to starting surgery. We make a very small vertical incision centered on where the nerve is compressed. And again, we verify this under X-ray guidance. We then, under X-ray, place a small dilator and dock it on this bone, which we call the lamina, knowing that right under this bone is this disc herniation, which is compressing the nerve. We subsequently place larger dilators, which is about 18 millimeters, to allow better visualization of the bone. We then place this final retractor over the bone. And this final retractor here is our working channel where all of our instruments go through. So this right here is your lamina. We have to remove a small portion of this lamina, which allows us access to the disc herniation. And this is what we call a laminotomy. So as you can see that this is the laminotomy that's been performed, and now you can identify the disc herniation. Through small instruments, we can remove the disc herniation and any bone spurs that are there, relieving pressure on the nerve. And as you can see here, these are the two primarily tools that we use. One is a nerve hook, one is a kerrison, which allows us to remove the disc and relieve pressure on the nerve in a safe manner. We then remove the tubular retractor and close the incision. And this incision is somewhere between 2 to 3 centimeters on the skin. We apply a dressing, and then you're taken to recovery room. You're in recovery room and observed for about an hour to an hour and a half. And after recovery is completed, we send you home and follow up with us in our office in about 10 days.
Hi, I'm Melissa. I'm a registered nurse here at Cary Orthopaedics Spine Specialist. I'm with Dr. Mathur. I'm one of his nurses here. And next time you come in to see us for your last appointment prior to surgery, I'll be speaking with you about your spinal procedure. In the following slides, you will learn about spine surgery education, the risks, recovery, and frequently asked questions. First off, we have the general risks of spine surgery. These risks are quoted with our own office with Dr. Mathur, usually less than a 1% chance. We have infection, bleeding, paralysis, blood clots, persistent pain, dural tear, and anesthesia complications. A dural tear is a nick in a spinal cord sac that the spinal cord lives in, almost like a water balloon. If that is punctured in surgery, typically we can see that happen. Fluid leaks out, cerebral spinal fluid, and it is then given a patch during the surgery. That would keep you overnight. We would monitor you and watch it the next day. That is actually the highest risk on this list. Again, it is probably less than a 1 to 2% chance within our office here with Dr. Mathur, giving them all a low percentage rate. So we have some questions that are very standard here. Anytime we have people come in for spine surgery, we put the top 10 together. So here is that list. When can I drive? We definitely prefer you don't drive until after your first post-operative appointment. That's usually because of pain medications, possible weakness before surgery that lingers after surgery, and just your strength in general. Position for sleeping is always on your back or your side. If it's a cervical surgery, a neck surgery, we want you on your back or your side still, but then we also want you elevated. That will help reduce the swelling. Some people do actually require a brace for surgery. It's going to depend on the surgery itself and the mechanism of your surgery. Will I be in pain after surgery? Yes, you will be in pain after surgery. Typically at the incision site is most common. Sometimes residual pain from your prior symptoms are still present as well. We hope that there is some relief immediately, but that's not always the case. Returning to work is very different for everybody. It's going to depend on which exact surgery you're having and then also the job requirements pertaining to it. Do I need supplies for my incision? Yes, you will need supplies. So most commonly you're going to need gauze and tape. Each incision is just covered with gauze and tape when you leave the hospital, and you actually won't change that incision until your first shower, and which is the next question, which is standardly about 3 days. If you would look at that on the slide, it says you may also use Tegaderm with gauze. Tegaderm is a fancy type of tape that a lot of doctors use. We like to use it as well. It's a great use of tape. It can be expensive, so if you can find it at a reasonable price, it is worth getting. Also, island dressings. Island dressings are great as well because it comes with the gauze already attached. It looks like a big white Band-Aid. We talked about the showering. We do prefer 3 days. Some cases you'll have to wait 5 days, but we would talk specifically with you at your appointment about that. You do need to change your dressing, but only at shower day. So at day 3, you will take a shower, take your bandage off first, take your first shower, and then put a clean dressing on after that with your supplies that you had bought previously. When can I be intimate with my partner? Generally, we suggest about 6 weeks. Will I need physical therapy? In most cases, yes. Again, this is one of those questions that is just going to be pertinent to your specific surgery and recovery. All right, lumbar decompression, also known as a laminectomy discectomy. These specific risks for the laminectomy discectomy surgery include adjacent segment degeneration, instability to the spine, and recurrent disc herniation. Your biggest risk for recurrent disc herniation, which is a lot of people's fear, is within that first 6 weeks post-operative period. We also have seen it at the 1 year mark. It's not common, but we see it within the first 6 weeks and again at the 1 year mark. Top highlights of the post-operative care and recovery for the lumbar decompression laminectomy discectomy surgery. This is not a bed rest procedure. We encourage walking and frequent position changes. Sleep at nighttime and then be up during the daytime. You may return to your normal diet as tolerated as long as you're not sick with anesthesia. Please feel free to eat as needed. You may have a back brace for this procedure. Not everyone requires one. It's going to depend on your specifics of the surgery and how many levels it's going to be. If you do receive a back brace for this procedure, we will talk about it individually at your appointment. You may use ice to help with pain. No heat, please. Most commonly, pain will occur right at that low back at the incision site. You do not need to change your dressing until you take your first shower, which is 3 days after. So when you go home from the hospital, leave that dressing on, the same one that you left with, until shower day 3 days later. Take the dressing off, take your shower, and then put a clean one back on. Please do not use any lotions, oils, creams, or medications on your incision for at least 6 weeks. No lifting greater than 20 pounds. That also means no pushing or pulling, so be careful. We always advise you with grocery carts. And dog walking, very important for this procedure. You cannot walk anything greater than 20 pounds either. It's just a risk with the pulling mechanism. Returning to work is dependent upon your job requirements. Some patients may return to work after their first post-operative appointment. Maybe if they have a desk job, it's certainly easier to get you back to that, or if you work from home, while others will need a few weeks out of work. We will discuss this individually. Please notify us if you have fever, drainage at incision site, headaches, or new symptoms that were not present prior to surgery. Preparing for surgery. Dr. Mathur and or his highly trained staff is always available to assist with your questions or concerns. You can find that information on the website on how to contact us. You will have one last appointment prior to surgery. This is an appointment devoted to educating you with Dr. Mathur and his nursing staff. We will provide further information about your specific surgery and recovery. This is the perfect appointment to bring your questions and your caregiver to. Surgery can be intimidating, so please let us know if we can assist you in any way on making this a smoother process. And for further information, please visit www.mathurspinesurgery.com and then follow the links below.